So I was actually talking to Professor Clancy this morning, and he mentioned that he met Anthony Fauci. Robert, when was this, and what was the circumstances?
I can't remember the exact year, but I had been at McMaster University. I came back,
Canada.
and and I was setting up the immunology unit at Prince Alfred Hospital in Sydney, and in those days we were treating a lot of people with a disease called necrotizing vasculitis, polyarteritis nodosa. Sjögren's, there are a whole lot of names.
Inflammatory
they're nasty diseases where
kills off the
arteries become inflamed. Yeah. And we'd been using, as a number of people in England have been using, a drug called chlorambucil, which is a cytotoxic drug, an alkylating agent that will destroy rapidly dividing cells, and was an important part of the treatment. And then a paper came out in the New England Journal using cyclophosphamide with, I think it was 12 patients, by some chap called Anthony Fauci.
12 patients?
Yeah. Well, no, that's a lot of patients for a rare disease.
Okay. So that's true.
I was pretty impressed that he had 12 patients.
It's a cohort.
And so I was going to the States literally at that time. And this is before faxes, this is going back a bit. And I can't remember how we communicated, but I said, look, can we get together? So he invited me to visit him. He was the National Institute of Health, even in those days.
Even then, yeah.
And he was the second in charge before he became... anyway, we really got on extremely well. We were the same age. We both married Christines. And
as indeed did I.
we were slightly different personalities. Yeah. Tony was an extraordinary guy. First of all, I said, where are all these patients that I'd like to see them? I said, well, actually, in America, we do things a bit differently. If I want to study this disease, I can put out an advertisement and say, look, we'll pay you fair. And so we get people from this extraordinary country all coming to the National Institute of Health. We initiate the treatment, and then off they go. We don't necessarily see them again. And which is very different to the more British style, I think, of medicine medical research that we used. And anyway, I was trying to tell him how chlorambucil was just as good. But of course, his paper was in the New England Journal, and cyclophosphamide became, the standard treatment for as part of the treatment anyway for this disease. And anyway, after that, we really did get on quite well. And I guess we saw ourselves as the young Turks of our respective countries' immunology, only because it was a long time ago and we were the only ones.
So you drank
pretty
beer,
much.
Drank beer together.
Yeah, no, there was a very good guy at St Vincent's Hospital in Sydney. But other than that, clinical immunology outside of the Hall Institute with Ian Mackay, who was really the father of autoimmune disease and my great mentor, outside of that, there was no clinical immunology. And we actually had to create it as a specialty. And Tony was doing the same over in America, which was much more difficult because in the States you had a very well established allergist on one hand, rheumatologists on others, and no one likes giving up their territory. So I don't think Tony tried very hard, because at this stage, little after, we used to meet and have dinner when I was over in his area. And then HIV came in the 80s, and HIV was an extraordinary impact on clinical immunology. I, at that stage, had moved to a new medical school at Newcastle, and I was running the clinical immunology unit at Newcastle, as well as the university.
And you were still working as a consultant physician?
I set up the immunology unit there, which was laboratory and clinical. And fortunately, there was a good New Zealand guy who I'd actually recruited to look after allergy, but he got very interested in HIV, because I found this very stressful medicine, very difficult. It was completely different style of medicine, and so David took over and ran that program. But Tony moved completely into HIV, and the rest is history. And he went along, got very involved in administration, ran the NIH department, and
you stayed by the patient's bedside.
I stayed very much. My research was mucosal immunology, which is a bit different. My clinical medicine was more the vasculitis. I kept with that autoimmune disease, hypersensitivity diseases.
Yeah, and now we could argue that you're even better known now than.
No, I don't know. I don't know about that. Tony's. I actually tried to contact him at the beginning of COVID, because it was clear that he was calling the shots.
Yeah.
And I did get an email back from his assistant. Right. Tony, if you're watching this, I'm still waiting for a personal email.
Yeah. And if he wants to come and be interviewed, then he's welcome. And
he's an interesting character.
We're both open for dialogue. Let's leave it at that. Fascinating history. Yeah. Thank you, Robert. Yeah, brilliant.